Alrighty, I have 4 o'clock, so we can go ahead and begin. Just so everyone knows, we are recording this presentation so that we can share it on our YouTube. Don't let that discourage you from using the chat box to post questions, but just wanted to make sure everyone was aware of that. So welcome. Today, we're going to be talking about pain management. You all can think about this presentation as a sort of pain 101. We may not get into very complex situations of pain, but we will be going over the different types of pain, as well as the breadth of pain management strategies that are out there. So before we get started, I'll introduce myself. My name's Alex Chan. I am an extension specialist with the University of Maryland Extension, and we're bringing this program to you through our Maryland ROPTA initiative, which is a statewide program that we are carrying out and have been since 2019, all about addressing the overdose crisis in Maryland through various aspects. We have a public awareness component. We have a training component where we increase the capacity of individuals to respond to mental health crises in their community. And then we have other sort of special topics that we cover that are related to the overdose crisis. And so pain management is one of our newer topics. So our program coordinator, Jade, has put some useful information in the chat box for you all to access. The website.
Alex, you've unmuted yourself.
I did not mean to do that. All right. The website is where you can find more information about our programs overall. And Jade has also included our program packet, which highlights all the different programs that we offer. And you can use that packet to decide whether you want to actually invite us out to your community or your organization. As I said, Maryland ROPTA and University of Maryland Extension is statewide. So we will come to you no matter where you are. We have offices all over the state. Even though this program is virtual, I'm based in College Park. I go all over the state, and we have educators out in your communities as well. So if you're interested in something that you see in the program packet or on our website, don't hesitate to reach out to us. And Jade, if you can also put the ROPTA email so people know where to get in touch with us. Our website also has a request training button. So there's a lot of ways that you can continue to consume our programming. As a recipient of federal funding, I want to remind you all that our programs are open to all. And if you feel that you need an accommodation to participate in any of our programs, or that you feel that you've been discriminated against in any way, we do not stand for that, and we have the information here for you to reach out if that's a concern of yours. All right, so I want to acknowledge I'm not the original author of this presentation. So this presentation was originally delivered on a nationwide initiative called Agribility, which is a initiative that is supported by USDA to increase the participation of individuals with disabilities in the field of agriculture. And so this presentation comes from that network, and with permission of the original author, I've been allowed to do this presentation here in Maryland. So the contributors are here, and I thank them for giving me access to this material. You may wonder, well, it came from a farmer's webinar, huh? Well, that's because, of course, as you can imagine, farming is can be a very physical profession, which puts the individuals at risk for issues with pain, whether it's from injuries or just from wear and tear over time. So that's kind of how this presentation came into the farming world first, and then now we're offering it here for everyone. You'll notice too that throughout the agenda today, there will be some occasional references to farming. So I see that they're based on your names here. It looks like there may be some folks affiliated with farming here. So I hope you can appreciate some of those metaphors. And for everyone else, I'll make sure that it's relatable. So here's our agenda today. I'll open with an argument for why we have pain and why it's actually a needed thing. I won't call it good, but I'll say it's needed. Then I'll take us back to school a little bit for a lesson on what causes pain and different types of pain, and dig a little bit into the pain experience. Like I said, this is more of a, I would say the class overall is more of a pain 101. I know there's a lot of different situations that people may be living through with regards to pain, but we don't have time to cover all of that today, so it'll be more of an introduction. And finally, I'll cover some strategies for managing pain and some resources to get help. And this is a portion of the training that I hope you all can really take away something from, as I hope that it expands your view of how pain can be addressed. All right, so pain. It's something that we all try to avoid. We all have it, and as we'll discuss, we all experience pain differently, whether we're talking about the physical feeling of pain or psychological input that it helps us interpret pain, or even coping poorly with pain. So some of us may appreciate pain, but very few of us actually want to experience pain. But as the title of this slide suggests, pain is actually a gift. We need it. There is actually well, and all the reasons you see on your screen is sort of why we need it. There's actually a condition, a congenital condition called congenital insensitivity to pain. And people who are born with this condition feel absolutely zero pain. Now, because pain is actually essential to our survival, it gives us really important information. For example, that third bullet, something is wrong. We need to know when something's wrong with our body. And for people with this congenital insensitivity to pain, they don't actually feel when they've burned themselves on the stove or hurt themselves on the playground as a child, or have some kind of internal issue like an infection or even worse things. So most of the time, because you can't really detect what's going on with yourself, this leads to premature death, often by the age of 25, if these folks are lucky. So that's a really extreme example with that congenital condition, but it highlights the reason why we do actually need pain, unfortunately. So we'll pick up with our back to school lesson here with a bit of history. So actually Rene Descartes was one of the first folks to really do more methodical thinking and writing about pain. And he actually suggested that he was one of the first to suggest that pain is actually linked to the brain. His idea, as you can see the illustration here, is that there is some kind of, straight transmission line from the point of contact wherever we're injured directly to the brain, and then we feel pain. So I would venture to think that most of us probably understand pain in this way as well, in a pretty straightforward way. And of course, we know that it does involve nervous system activity, sensations transmitted along the nerve fibers to the spinal cord and up and down to the brain to process pain. But it is actually not so simple, as we'll get into in just a moment. Descartes was actually one of the first folks to actually really be studying phantom limb pain, and because he recognized that there was pain but no limb, he concluded that pain must come from the brain. So that's partly what helped him make this connection between the brain and pain. So let's look at pain a little more closely. Of course, there's things that we can, obviously consider that cause pain, things like injury and accidents. There's also muscle pain, which is very common. There's everyday aches and pains. There are certain pain sensations associated with disease, cancer, diabetes, arthritis, and also emotions. People will report feeling pain when they're very depressed. People will report feeling pain when they're experiencing really bad heartbreak, some kind of breakup. Also, really intense stress can contribute to more extreme versions of those everyday aches and pains. And then there's some pains that people can't really describe. There's no real reason, nothing a doctor can diagnose with certainty, maybe even an old injury that has healed, but you still feel pain. And so it's hard to figure out what that's all about. So there is a lot of research being done. I even know of some researchers who are studying cancer pain at the University of Maryland School of Medicine in Baltimore. So there's a lot of research still being done to understand the experience of pain because we are now realizing that it's not so simple. So there we go. Fast forward to closer to today. We're about 350 years after Descartes, and now we have a much more complete understanding of pain. Even though we're still doing research, we understand a lot more than he did. So much so that we have this textbook of pain where I know a lot of the information in this presentation came from. And, the one way of looking at it is that we have now 7 pounds worth of pain, because that's how much that textbook weighs. So the researchers have started to classify, those different categories of pain and, where different types of pain are located in the body and different types of pain depending on the tissues that they affect, whether it's muscles or other organs, as well as the mechanisms causing the pain to occur. So we'll go through most of these really quickly just because, as I said, we don't have enough time to cover everything in detail. But just to give you a broad view, many of you may have experienced these types of pain or know somebody who's experiencing these types of pain. So the first one, cancer pain, it gets its own category, and the tumors and things that are associated with cancer, the growths, they don't have nerves to generate pain on their own. Rather, the tumors can cause damage to the surrounding tissues, which include nerves and bones and muscles, which is what causes pain. Also, cancer treatment like radiation and chemotherapy can cause pain. And this is one of the more complex forms of pain. It can be very different from person to person and where the pain is located depending on the type of cancer and the type of treatment. Visceral pain. This is a pain that is diffuse, meaning it doesn't really feel like it's in one very precise location. It's sort of in an area, a region of the body, might be hard to pinpoint. This is often related to organ issues. So things like abdominal pain, thoracic pain in the chest, sometimes that's associated with a condition like a heart attack, stomach aches. Those things are grouped into visceral pain. Headaches. I think I have one of those right now. So headaches and facial or orofacial pain includes things like migraines, tension headaches. That trigeminal neuralgia is a pain in the facial nerve, very painful nerve disorder. Also, things like toothaches fall into orofacial pain. Um, Neuropathic pain is a broad category. covers all sorts of issues related to pain from nerve injuries. So that could, result from things like diabetes, or it could be, a result of other injuries. So nerve injuries, could be a nerve that was cut and is trying to heal itself. It could be a nerve that's inflamed, like sciatica, or it could be a nerve that is no longer there, but the brain pathway still exists. So that would be your phantom limb pains. And then there are some diseases that affect nerves, as I mentioned, like diabetes. So pain in general can be tricky to treat, but neuropathic pain is among the most challenging categories to treat because this pain involves really complex interactions of the nervous system and the location of the damage, and a predisposition of the person to nerve challenges. So the last category of pain is deep somatic tissue pain. So basically, what we know is that there are nerves that are in our muscle tissue. That's what allows our muscles to move, is that the brain sends signals to the nerves that are in our muscle tissue. And so muscle pain would be part of deep somatic tissue pain, arthritis, and even referred pain. So that's where when I have some more specific information about that. So I'll go in order here. Myofascial trigger points, that's basically where it hurts when you press on it. So that's a plain language description of these trigger points. So it's a very specific pain that you feel on the compression of tissue, pressing on it. And this can lead to pain in other locations of the body, which is referred pain. So sometimes the pain you feel in one part of your body is actually caused by pain or injury in another part of your body. So using the heart attack as an example again, you might feel jaw pain or left arm pain. Those are very, well-known symptoms of a heart attack. So even though the heart is the actual location of the injury or the problem, the pain is referred elsewhere. And this researcher, Dr. Janet Travel, is recognized as in the study of pain. She actually is an important historical figure. She treated JFK for his back pain. You can see her here with him in a rocking chair because that was actually her prescription, or one of her treatments for him, to alleviate some of the compression and alleviate some of the back pain. And if you look up research related to rocking chairs, there is a fair amount of research showing that it can help relieve pain and also help with things like anxiety. We all have a sort of instinctual response to being rocked. And so a rocking chair allows us to rock ourselves and experience the soothing benefits of that motion. So actually, because Dr. Travel was, so well respected in her field at the time, in the 60s and 70s, she was actually part of the development of the float ride seat, which was a really great ergonomic advancement for farmers. This was the John Deere float ride seat, which was introduced in 1958. And this gave farmers a much smoother and more comfortable ride on bumpy farm fields. So you can imagine the wear and tear done on the body when you're just, bouncing around on a stiff, seat all day. And so her working with John Deere allowed them all to develop this more ergonomically sound seat for the tractors. And it incorporated the knowledge from all of the categories that we just mentioned, the study of how pain works. So she knew about trigger points and myofascial pain and ergonomics. And so her design suggestions included things like foam padding, springs, and a hydraulic cylinder to absorb shock. So all these things were significant advances at the time. It's always interesting to see how science and research can translate into our everyday lives. You'll even see these types of seats, for other large vehicle drivers. I think I've seen them on buses and vehicles like that as well for the drivers. So I'm going to pause in our, lesson information dump for a second to give you all a take-home point related to exactly that. So for all of us who may not be riding tractors all day, a lot of us may be driving a vehicle of some kind every day, your own personal vehicle. And there are adjustments that are very easy to make in your vehicle to increase the ergonomics and therefore decrease the likelihood of it contributing to pain. So as you can see in the image here, I bet not a lot of us have our car seats positioned in a way that is ergonomically correct. The image on the left shows that the seat should be just slightly reclined, not where you're leaning back like all the way on the right. It should allow for your legs to stretch out a little bit, but not to be reaching. And it should generally, your arms shouldn't have to extend all the way either. All those things, whether you're in both of the the red X pictures, you can see that if you're either hunched over or stretching too far, then you are going to increase the likelihood of experiencing soreness and pain. Now, if you also factor in traffic to all that, this becomes not only a, way to increase or decrease the likelihood of pain, but also probably give you a little more patience in sitting through some of that traffic wherever you might be. So, just a quick note for everyone to go check your vehicle, as soon as maybe some of you are listening as you're driving home right now, but as soon as you can, go and make sure that your steering wheel is pulled close enough, your seat is, giving you a good posture, because it's one very easy method of reducing the likelihood of pain. All right, so one of the things to add a little complexity here, we've talked about how we feel pain and that nerves are responsible for pain. But one of the things that I want to introduce you all today is that the nervous system itself can control pain. We're not always at the mercy of, the signals coming in. The nervous system itself can actually control our experience of pain. And there's a couple different studies and theories of pain that have emerged over the past several decades that show how the nervous system works in that respect. So gate control theory, this basically, to sum it up, the idea is that there are a couple gates to gateways to the experience of pain. One is the spinal cord, and the other is the brain itself. And pain signals may enter from the periphery, from outside of those zones, and they either continue or they don't. At the same time, your body's natural opioids or pain-killing hormones are traveling down from the pain to those same gates to reduce pain. So there are, there's only so many signals that can be on. It's kind of like the traffic that I just mentioned. There's only so much that these pathways can process at once. And that is why, for example, if you have a bug bite and it itches and you slap it, you temporarily don't feel the itch, which is, a form of pain, because there's only so many there's only so many signals that your nervous pathways can handle at once. And so that is part of gate control theory too. This is also explains why you know, when there's things like battlefield wounds, that people will report not experiencing, you know, a really intense wound until later, is because the system was flooded. You know, the gates, you know, there was only so much room for signals, and there was so much going in at once from whatever like traumatic injury there was, that it just, you know, that the pain signals are actually blocked. Not being a neuroscientist myself, that is the extent of which I can explain that theory. But hopefully that makes sense to everyone. So just as though the brain can reduce pain sensations, the nervous system can also exacerbate pain. So this is where, you know, if you might be injured in one area, but the pain spreads and starts to hurt in many different areas. The thought behind that happening is that it's sort of like a overall signal to rest and heal. But of course, the experience of pain itself is more expansive than it, I guess, has to be. Okay. So the more recent advances in our understanding of pain have come with some technologies like PET scans and MRIs, and imaging has allowed us to observe exactly what's happening in the brain and when we experience pain. So there are you know, experiences of acute pain, and there's also experiences of chronic pain, and these are associated with different nervous system activity. And so it's, you know, people are starting now to understand, you know, the different zones of the brain involved in these different types of pain experiences. Now, one thing that I really want to highlight here is that our thoughts, feelings, and behaviors matter to our pain experience as well. So I mentioned I'm an extension specialist. My area of specialty is mental health. And so I was really interested in this portion of the um, pain presentation, because it is true. There is a lot of published research on the influence of cognitive and behavioral treatments to assist with managing pain. So we'll talk a little bit more about that when we get to the treatment section. But suffice it to say right now that your psychology can affect the pain experience too. So one thing that we still, you know, even as we're gaining all this understanding of how pain works, one thing that we're still not great at is measuring pain intensity. Most of the time, people might have seen this image at the doctor's office. This is called the Mosby Pain Scale, to try to get an assessment of somebody's level of pain. But really, if you ask people who deal with pain issues or chronic pain, they'll say that the experience is something more like this. Sorry for the gruesome picture, but this is kind of more in line with the consumer's experience of pain, that the image in the doctor's office doesn't really do it justice. And therefore, we still have a ways to go in measuring measuring how severe somebody's pain experience is. So we want to be able to, of course, assessing pain more accurately will help us be more empathetic and ask the right questions. And so, you know, because we can't feel each other's pain, we have to try to, you know, develop interpersonal ways of assessing that pain. And hopefully it helps us provide more appropriate treatment. So this leads us into pain management. So I'm going to bring back a farming analogy here. In the world of agriculture, you are constantly facing multiple types of pressures, one of them being pests. So there's a variety of pests, there could be a fungus, there could be deer, bugs, all kinds of different things that will impact your productivity as a farmer. And my extension colleagues in the agricultural program spend a lot of time educating farmers on a method called integrated pest management. And the philosophy behind that is that if you take an approach like this, where you see this word pesticide all over the screen, and the idea here is that you're using the same pesticide in all these locations. If you do something like this, you're not as likely to have the results that you're looking for. You're less likely to actually take care of the pests, or the pests will become resistant really quickly to whatever you're doing. And so this won't be a lasting fix. So my colleagues often teach in their seminars, they'll teach about integrated pest management, which instead of having pesticide be uniformly used in all locations, they'll say, okay, well, maybe a pesticide is appropriate in that field out there, and then maybe a different form of treatment is useful on different fields. Like this closer field is maybe needs an insecticide, a different field needs a fungicide. So that you are actually, and maybe in the house you're using, something based on vinegar, and then, you move the animals around to help, distribute nutrients differently. And so there's a lot of different techniques that go into managing pests on the farm. And so what we encourage you all to think about is that pain is the same way. There is not a blanket approach to managing pain. Some people, certain types of pain might do fine with something just like Tylenol or ibuprofen or some kind of other over-the-counter thing. Other types of pain may require different treatments and management strategies. So, and sometimes you don't need chemicals or drugs at all, when behaviors like eating a healthy diet and exercise are sufficient to address the issues. A lot of things like with I recently injured my wrist playing sports, and my friend, who's a physical therapist, encouraged me to keep moving it. And so that's an example. Is sometimes, definitely not all the time, sometimes there are other ways to manage pain. So basically, we have to think about all options when we are addressing pain. Pain is complicated, and therefore we have to take a more nuanced approach. There are certain drugs, things like opioids, that work very well to alleviate acute pain, and sometimes are used in the management of chronic pain, but they, of course, carry a high risk of misuse or abuse. So we can't be overly reliant on just one method. For example, in some cases of pain, physical activity can be as effective as an NSAID, something like ibuprofen. Physical activity can be just as effective. So we also know that other lifestyle strategies like losing weight is effective in reducing pain for people who have knee problems, and just from reducing the load on joints. So again, encouraging us to think about an integrated pain management strategy. So I'm going to cover two overarching categories related to pain. One is going to be treatment and management strategies to eliminate pain when possible, or to manage it at a level that allows you to stay engaged and productive. And the second will be ways in which pain treatments and strategies can be delivered. So first, with the treatment and management strategies. There are some strategies that fall into the category of lifestyle modifications. So these are what a healthcare provider would call a conservative treatment or a non-drug treatment. And most are highly recommended among organizations like the American Academy of Rheumatology, orthopedic surgeons, and quite a few others. So I already mentioned physical activity. Most of us already know that it can be the wonder drug, and it doesn't take much. People who work towards 150 minutes a week of moderate to vigorous activity, as the standard for any of us who aren't there, it's just do more, just move more. You get the largest improvements when you go from doing nothing to doing something. So start low, break it down into chunks, 5 to 10 minute activities throughout the day, and you'll notice your numbers start to creep up. So don't think you have to jump straight from 0 to 150 minutes instantly. Anything to get you moving is good. So next we have weight management, reducing your weight if you're overweight. Achieving and maintaining a healthy weight is important for reducing pain, especially for arthritis. This can also reduce inflammation, which is a symptom in many pain conditions. And again, weight management is often through things like physical activity, but it's also through diet. And both physical activity and weight management are effective for reducing other chronic conditions that chronic health conditions that people generally want to avoid. Okay, injury prevention. So this is important for reducing the risks of acute and chronic pain. So doing things that, bringing us back to the farm. Preventing falls is key. We know that in our farming population, the average age of our farmer, owner, operator is in their late 50s to early 60s. And so fall prevention is really key, especially for older adults. So anything you can do to prevent injuries and promote safety in engaging in physical activity or other, semi-dangerous activities is good. So for example, again, in the farming community, we have things like tractor safety for youth and adults, but these are things that prevent the kinds of injuries that would cause acute and chronic pain in the first place. For the rest of us who may not be working on farms, these are through using other common sense types of preventative activities. Wear your helmet when you ride your bike. Use your seatbelt in the car, and try to think about your body mechanics when you are lifting and doing your normal daily activities. Even things like going to the store and lifting a heavy purchase can cause an injury. So think about safe movement practices. And again, going back to physical activity, things like yoga teach you the type of body awareness that can help prevent injuries. All right, so our next strategy, cognitive behavioral therapy. Of course, as a mental health provider myself, I think that this is really cool that something like cognitive behavioral therapy can be part of the pain management experience. And the way that it helps is, you can't think yourself out of pain. However, study after study shows that when you adopt mindfulness-based strategies and other cognitive behavioral techniques to kind of cope in the moment with the experience of pain, that the severity of the pain goes down. So I've heard from other personal contacts that are, going through experience of pain that the apps that a physical therapist may know about, that teach you mindfulness exercises that can be done at any time, significantly reduce the experience of the intensity of the pain. I had someone tell me that if they're sitting in the car and they're dealing with lower back pain and it flares up, if they turn on that meditation and listen to it um, while they're driving with the pain, that the pain goes from like a 7 to a 3. So that's anecdotal, of course, but also there is a good amount of research backing mindfulness-based and cognitive behavioral approaches to reducing pain. Now, again, it's not a silver bullet, but it's another tool in the tool belt, and one that a lot of people may not be aware of. Okay, so there's also medicine. So I'm not a medical doctor, so I'm just going to give a high-level look here. You can see there's different types of medicines that can be taken. And I know I said that this presentation is being done as part of our, overdose response and all that. But opioids are a legitimate option for pain, and they can be life-changing when used properly. I've had folks mention to me that without opioids, they would not be able to manage the effects of certain acute injuries, and that it actually allowed them to live a somewhat normal life. One side note here, just to address stigma related to opioids, is that somebody's physical dependence, they may, under the guidance of a doctor, be prescribed opioids for pain management, and they may indeed be dependent on them. But physical dependence is not the same as addiction. Addiction is where, you're not really, when you have a disorder, you're not responding to the negative consequences of the addiction. And that's just not the same as merely having a physical tolerance to something because you've been using it and prescribed by your doctor. Tolerance and physical dependence can develop really quickly. So just wanted to put that out there, that opioids are a legitimate option under the guidance of a doctor, and that dependence is not the same as addiction. So, of course, there's a variety of medical options here too. Besides, oral drugs, there's also topical and injectable drugs that fall into these categories. Things, some examples, for rheumatoid arthritis, there are some, there are some treatments available that can slow the disease process when started early. But that's kind of unique in the world of pain. There's not a lot of pain conditions that have a really great treatment like that. And then beyond medications, there's also assistive and adaptive devices. So these are things like braces, tools, mentioning again, farm equipment, different ways of, bringing back the old float ride seat. There's ways to adapt to the demands of your workplace and still be able to carry out your work, and not have it really inflame your pain. Now, of course, all of these strategies, whether it's lifestyle management or medicine, devices, they all have their ups and downs. With medicine and devices, sometimes it can be expensive, and there may be some challenges with these devices and fit. But again, we're thinking of an integrated approach. All of these things should be explored. And then finally, surgery is last on purpose. There's a lot of reasons why people might undergo surgery to address some kind of issue. But, it tends to be a last resort. Certain things are fairly common, like joint replacement, but it is really invasive and it's not always the best option. So as a advocate for yourself, make sure that if you are considering these types of operations, to ask questions, understand the risks of anything that you're doing, and proceed with caution. Most people don't realize that they can ask questions of their doctor and try to understand their reasoning. If they don't feel comfortable with the amount of information, you can ask for more detail. So make sure that you're being your own advocate when you visit a doctor. When in a profession like that, they're under pressure for time. And so if you don't ask, they might just move on. All right, so where do you go to seek care for pain? You can go to a doctor's office. This one's obvious. Could be a primary care or a specialty care. So that would be somebody like a rheumatologist, or even if it's cancer pain, the oncologist. So there's a variety of other professionals that may work hand in hand with the primary or specialty care providers. That may be somebody like a physical therapist, occupational therapists, and psychologists, someone in my world, someone in the mental health world. All of these people can help you treat and manage pain. Traditionally, this will take place in a medical facility of some kind. However, we're seeing more and more telehealth options as well since after COVID. Remember, though, there was all those other lifestyle-based ways of managing pain. And so where do you go to get assistance or information about those things? Community centers, senior centers, Parks and Rec, YMCA, library, all these community-based organizations may have programming, including extension. So here we are. All these different community-based organizations will have information on evidence-based information on physical activity, disease management, even things like social support. That's where the church or faith community may come into play. So pain, again, it's integrated. Think back to that field. You're not just throwing a pesticide out there on everything. You're using this product here, that product there, this practice over here. So although a lot of discussions of pain may begin in a medical environment, you have all these community-based options to help you with some of those lifestyle-based changes. Now, of course, depending on where you're at, there may be a lack of some of these local resources. I know that some of you, if you're joining from, a place like Garrett County or Kent County, where the population isn't as high and therefore there aren't as many publicly available resources, that can be an issue. So transportation may be a factor here. There are also some home-based options. So if transportation is an issue, then you might be able to log in to certain resources. I mentioned, the apps that will cover that more cognitive behavioral element of managing pain. You can access doctor's appointments and things virtually sometimes these days. And there's also programs that are done. If your internet can't handle a live stream like this, there's also perhaps less intensive web-based pain management learning modules that are out there. Of course, I realize that with these options, the same areas that may be affected by lack of resources, in community-based options may also be affected by technology access being limited, broadband issues. So at this point, that's where you start getting into the political realm, where you need your local officials' help to get that access, improving the infrastructure in your area. So I would highly encourage you all to get in touch with local officials if that's your issue. Fortunately, Maryland does have a pretty strong push right now from the state level to increase broadband access, but depending on your community, it may or may not be getting to you as fast as you'd like. So make noise if it's being too slow. All right. So here are some resources that you may find useful. Of course, this information comes from the Osteoarthritis Action Alliance, which is actually based out of the University of North Carolina. The Agribility Project is what I mentioned to you earlier, which is enhancing the participation of differently abled people in agriculture. And then one of those pain management programs online is called the Pain Trainer. So I encourage you all to take a look at these resources. All right, and remember, this is recorded, so if you can't get it all right now, we'll have the recording on our Marilyn Roped YouTube. And that is all the information I have. So I am happy to entertain questions now.